Great. Good afternoon, everybody. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale. I'm also here with Dr. Brenda Weiss, Administrator of our Office of Public Health, and Dr. Alvin Wong, our Regional EMS Director. So this continues to be a very rapidly evolving situation here in Montgomery County. I will do my best to answer all of your questions. I am quite certain I will not be able to answer all of your questions fully, but I will absolutely do my best. As has become our practice, I will update you on what has happened here in Montgomery County since our press conference of yesterday afternoon. Since then, we have been notified of 4 new presumptive positive cases of COVID-19 in Montgomery County, which brings us to a total of 13. The first is an adult male, 35 years old, who resides in Skippack Township, whose symptoms do not require hospitalization and is currently at home being monitored. This individual had direct contact with a previously identified presumptive positive individual in Montgomery County. Contact tracing is underway. The second is an adult male, 58 years old, who resides in Lower Marion Township, whose symptoms do not require hospitalization and is currently at home being monitored. This individual traveled to a location inside of the United States where coronavirus is known to be active. Contact tracing is underway. The third is an adult female, 53 years old, who resides in Lower Marion in the same household as the individual noted above. Her symptoms do not require hospitalization, and she is currently at home being monitored. This individual also traveled to a location inside of the United States where coronavirus is known to be active. Contact tracing is underway. The fourth is an adult female, 58 years old, who resides in Conshohocken Borough, whose symptoms do not require hospitalization and is currently at home being monitored. This individual had direct contact with a previously identified presumptive positive individual in Montgomery County. Contact tracing is underway. Given the continued spread of COVID-19 across Montgomery County, we are escalating our efforts to protect critical members of our workforce and the infrastructure in which they operate, specifically our hospitals and hospital personnel, our first responders, our grocery stores and pharmacies, and the supply chains behind them. As you may know, about an hour ago, Governor Wolf announced a decision which we fully support to require the closure of all public and private Montgomery County schools, including their transportation systems, effective tomorrow, Friday, March 13, 2020. It includes schools of all types, such as pre-K, higher education, and private schools. State licensed daycares are also closed under this order. This order is in effect for the next 2 weeks. We will reassess the situation on an ongoing basis and may extend this order as warranted. Additionally, we are using our authority under the County Public Health Code to prohibit all mass gatherings of any size that are outside or in temporary structures. This order is in effect for the next 2 weeks. We will reassess the situation on an ongoing basis and may extend this order as warranted. An hour ago, Governor Wolf also announced, under his authority, the closure of community centers, gyms, and entertainment venues. I'm now reading from his remarks. This includes YMCAs, theaters, sporting events, concerts, and non-essential retail facilities. No mass gatherings should be held, including conferences and rallies. This order is also in effect for the next 2 weeks. We will reassess this situation on an ongoing basis and may extend the order as warranted. We, here at the county, are imploring our community to cancel non-essential public and private gatherings, both indoor and outdoor. For our business community, we urge you in the strongest possible terms to enable all employees to work from home wherever possible. The goal is to protect members of the public whose jobs are critical and cannot be done remotely. If you do not offer paid sick time, please work to do so during this emergency. My advice to our business community is to work from home now or risk not being operational later due to employees becoming exposed or ill. Additionally, the governor announced that any state employee, and I want to emphasize, he announced only about state employees traveling in and out of Montgomery County between their workplace and home are being directed to work remotely. Montgomery County government will remain open and continue to offer essential government services. For the public, we know that this is difficult, and we urge you to continue to remain calm as you have done all week. We got our first calls about presumptive positive cases here in Montgomery County just last Saturday. So this has been a lot and a very rapidly evolving situation. And I want to thank everybody who has stayed calm, made good decisions, and we ask you to just continue to do so. The public health goal of these unusual measures is illustrated by this chart. This chart is a graphical representation of how communicable disease transmission can spread without mitigation compared to with mitigation. So our goal here is to flatten the curve. So just as by example, this big spike is what can happen when there's a communicable disease out there and no steps are being taken to slow its spread. You can imagine with a spike of that size, we could easily overwhelm our hospital and healthcare capacity, as well as the ability of our first responders to serve the public in an emergency. What our goal is to achieve this smaller purple bump, which acknowledges the fact that we are still going to have disease here in Montgomery County, but we're hoping to slow the rate of spread of disease and to decrease the ultimate total number of individuals who are impacted. So this is our goal from this set of very unusual measures. I want to assure the public that we are learning from the countries and the states that have come before us. We are fortunate to have the opportunity to learn from their experiences. And we are taking evidence-based measures to mitigate the spread of coronavirus in Montgomery County. We know that you will have many, many questions. We urge you to first check our website. That URL is www.montcopa.org/COVID-19 for up-to-date, accurate, and most importantly, trustworthy information. If your question cannot be answered by visiting the website, Montgomery County residents may call 610-631-3000 between the hours of 7 a.m. to 8 p.m. on weekdays. We will announce weekend hours as we verify them. But please check the website first. We have an extensive amount of information on the website. There are links to information in Spanish, Korean, and Chinese. Many of your questions can be answered by visiting the website. And again, that is www.montcopa.org/COVID-19. covid-19. I want to reiterate, if you are experiencing symptoms of COVID-19, which are fever, cough, and shortness of breath, please stay at home and call your healthcare provider. Do not arrive unannounced at your doctor's office or nearby hospital. I want to remind everyone that the vast majority of people who get this, 80%, should have very mild symptoms. However, those that are most at risk are elderly, have serious underlying medical conditions, or are immunocompromised. That is who we're trying to protect, along with our first responders, our hospital workers, and other critical workforce members. With that, I will take your question.
Any fatalities to this point?
Not that I have been informed of. The question was, are there any fatalities at this point? I have not been informed of any deaths.
Is this considered a cluster now? And could you explain what constitutes that, what that would be?
Well, the way that I would characterize it is that we have the largest number of cases of any county in the state of Pennsylvania. So I don't think we technically meet cluster status. A cluster usually is defined as a situation where there are a large number of cases from one place due to one individual being there and infecting a lot of people, like there's a church, I believe, in Italy where that was the case. So no, we've had individuals acquire infections from travel inside the United States, outside the United States, direct contact, but lots of different routes. So I would not characterize this as a cluster, but we do have the most cases of any county in the Commonwealth right now.
When you say no mass gatherings, that means no
Of any
classes,
size,
no
no.
church, no Sunday school, no nothing.
So it's a complicated situation in terms of what any of us have legal authority to do. So I'm going to try to clarify that for you. Here at the county level, make sure I get this right. Here at the county level, under our authority with the County Public Health Code, we are able to prohibit all mass gatherings of any size that are outside or in temporary structures. Typically, those are gatherings that require a permit. We would deny all of those permits. Okay? That's what we can do at the county level. The governor, and you may have to go back to the governor's office for clarification on some of this, the governor has, under his authority, asked for the closure of community centers, gyms, and entertainment venues. This is his language. This includes YMCA's, theaters, sporting events, concerts, and non-essential retail facilities. I can't define that for you. You'll have to ask his office. When it comes to our places of worship, we are asking our faith communities to please, for the greater good of our community, consider not holding large services, or if you do hold services, do your best to keep people 6 feet apart. Absolutely, there should be no shaking of hands or hugging or anything like that. We understand, obviously, that would limit the number of people who could attend. The safest thing is not to hold a service if you are able to do that in your community.
After yesterday's announcement of a police officer and contact tracing underway for him, any other first responders in this list here of people that have tested positive?
I've given you all the information that I'm able to give you at this point about the presumptive positives.
How about the determination of the 70-year-old Cheltenham Township woman in terms of that contact tracing?
So as of right now, we still have not been able to trace her illness back to a known presumptive positive. There are still a small number of people that we are trying to reach.
Are restaurants closed? Are restaurants and bars to close? Is that part of the non-essential retail?
Again, I'm sorry, but I have to refer you back to the governor on that. The question was, are restaurants and bars included as a non-essential retail facility? We got this information just a little bit ago, and we've not had the opportunity to clarify the governor's intent with that.
What about your intent though in the county? Would you, I know you don't have the authority to shut these places down, but are you saying to people that we don't want you to go there? We kind of want you to stay at home and do as little as possible right now?
Well, as you've heard me state pretty clearly for the last 2 days, we have been discouraging public gatherings here in Montgomery County, and we've now escalated that to that next phase where legally, both the governor and your county commissioners are saying that we are going to prohibit the things that we're legally allowed to prohibit. When it comes to a decision to go to a place, I think that what people need to do is consider their risk factors: elderly, immunocompromised, underlying medical conditions. Do they have someone like that living in their home with them where they can potentially bring something back? It is my best advice as a doctor to encourage people to try to limit their public activity as they can, but I don't have the authority to say you cannot.
I realize that the governor made this announcement and you're getting this information, so I'm just trying to clarify, since we're here with you and not with him. Is it his absolute authority to say non-retail establishments? I mean, by that, is it your understanding as a county commissioner that by him saying that that's basically an edict and those non-essential retail establishments must close, or is that his suggestion?
I can't answer that question.
Of the two cases that two of the cases that you announced today, you said they came from prior contact with somebody that previously had been identified as having COVID-19. Is that the same person in both of those instances, or are there two separate patients?
Let me just refer back just to make sure. Both of those individuals had direct contact with the same presumptive positive that we have announced previously.
And of the 13 total that you've announced, have you been able to determine how many of those cases have been spread by similar people? I mean, is there one or two patients that are spreading multiple cases, or is that still preliminarily being researched?
The numbers are very small at this point, so I can't give you a clear read on that at this point.
What if people want to get a test and are having difficulty finding a test for coronavirus? We've heard that's happened, that a man tried to make contact with a healthcare provider and said you didn't meet the requirements, but they feel that they are potentially infected.
So as of Monday, this past Monday, a physician can prescribe a coronavirus test for anyone that they believe warrants testing without going through the Pennsylvania Department of Health if that test is prescribed to go to LabCorp, which is a private commercial lab that the state has activated for the purposes of doing coronavirus testing in Pennsylvania. I believe that Quest Lab is also online or is coming online soon. So the difference is, to clarify, last week and up until Monday, if a physician wanted to order a test, that did have to get the permission of the Pennsylvania Department of Health. Now, a physician has the option of going through the Pennsylvania Department of Health, in which case the test would be run here in Pennsylvania at a Department of Health lab, or they can prescribe that the test be done at LabCorp and I think Quest at this point. However, one thing I want to be really clear about, they cannot send the patient down the block to the local LabCorp or Quest facility where they might normally send them to draw their blood. They are not doing that. They will not let those patients in. So the physician or clinic, wherever the patient is, does need to be the ones to collect that sample. And obviously the individuals in that office should have personal protective equipment on. Many of our hospitals here in the county are starting to ramp up and at least offer the obtainment of the sample. But again, that's where we want people to call ahead. So if their doctor can't do the test, they can contact, I would start with their closest hospital, let them know what the situation is and see if they can accommodate them, or ask their doctor to call ahead for them to the hospital to see if the hospital can accommodate them. What we don't want people to do is just to show up and announce and walk in the door. because again, we're talking about critical workforce here. We have to make sure that we don't have to quarantine nurses and doctors and orderlies and all of the people that work in our hospitals, because again, if we're not successful in our mitigation strategies, and even if we are successful in our mitigation strategies, we need every one of those people able to be working. So we want and must insist that people call ahead.
With other questions in mind and information you've given, are there any concerns that protocols that have been put in place may not have been as effective as you hoped?
You'd have to be a little more specific with that question. There's a lot of protocols in place right now.
For first responders?
First responders have been given very clear protocols about personal protective equipment.
And is it as effective as you hoped it would, or are there any concerns about that now?
I think that as long as an individual follows the protocol and puts the full personal protective equipment on, which includes eye protection, a mask, a gown, and gloves, there's no reason to think that they're not going to be protected.
I know you said that this is a recommendation from the governor's office, and there's not a whole lot that we have to ask him, but I mean, is it your understanding, is there any further steps where you could demand that some of these places shut down, or is this it as far as the stance that the county can take, where we're suggesting that some of these non-essential places keep the doors closed?
So let me just repeat what the governor said. He announced under his authority the closure of community centers, gyms, and entertainment venues. So those were the words associated with closure. He then went on to give examples of that, which were YMCA's, theaters, sporting events, concerts, and non-essential retail facilities. I think that is the part that isn't crystal clear. And again, I can't speak for the governor, and I'm not 100% certain what is under his authority, so I can't really answer that. I can tell you what's under our authority, which is that we're not going to allow permitting for any events of any size outdoors or in any temporary structure. We have that authority under our public health code. And of course, the governor closed all of our schools and state licensed daycare centers, which was a move that we would have made at the county level. We have authority to do it if we need to, had he not done so.
What is the setup on Egypt Road with the tents and the lighting and the sheriff's deputies near Audubon Elementary?
We have prepared a closed pod that might be used to help address the specific needs of first responders in order to help maintain their availability for emergency response.
But it's not being used yet, it's just,
Correct.
It's just there.
It's just there.
Back to the question about protective gear for the first responders. We are hearing some first responders, or at least one, has tested positive. Jim asked you about if protocols were in place. Does that mean that some of the protocols were not followed? Eye protection, mask protection, anything like
I'm
that?
not able to answer that question.
We're several weeks out. Are there plans for the election for the primary?
Commissioner Lawrence, who chairs our election board, the question was, are there plans for the April 28th primary here in Pennsylvania? Vice Chair of our Board of Commissioners, Ken Lawrence, is chair of our election board, and he will be happy to answer that question.
So we were already in planning process for the election on April 28th. Of course, this outbreak has changed that dramatically. We are recommending people vote by mail, which they're entitled to do under the change in state law. But we are also concerned because 22 of our polling locations are at senior facilities. And our poll workers tend to be retired and elderly. So we were on the phone with our delegation this morning, our state delegation. There's already been legislation introduced to go to mail-in voting for this primary election across the Commonwealth of Pennsylvania. We are in favor of that. There'll be some changes that'll have to be made with that, but at this point, we would favor going to mail-in voting for this primary election.
Any other questions? All right, thank you so much, everybody. I do just want to say one more time to the public, I know this is a lot in a very short period of time. I just want to continue to thank all of you for working together to put the needs of our community first. We we are abundantly clear that this is going to cause personal inconvenience for many, many people. But the goal here is to prevent that big spike, to keep the total number of people who are ultimately impacted by this disease to the smallest number that we can, to preserve our critical workforce, to make sure that our hospitals have capacity for anyone who does need to be hospitalized. And if we work together, we will get through this. Knock on the door of your neighbor, see if they need help, particularly if it's an older person. Maybe you can make a grocery store run for them. This is a time where we just need to pull together on our block, with our neighbors, with our friends, with our faith community, and together we will absolutely get through this. This will have an end. Thank you.
Val, can I ask one more? I know we're done. Do you mind?